Welcome to the AHS board meeting. I'd wonder if we could start by reviewing the agenda. Has everybody seen the agenda? Could I get a motion to approve the agenda if no one has any comments? Richard? Hugh? All in favor? Great, thank you very much. Declaration of conflict of interest, if anybody has any conflict of interest to declare. Hearing none, thank you very much. Approval of minutes. You all have your minutes there. Have you all had time to look at them, read them? Okay. Could I have a mover of those minutes? Brenda? And Hugh. Great. All in favor? Great. Thank you very much. Well, good afternoon, everyone, here and somewhere in the internet if you're watching. Thank you for joining us today. This is the first time the board has met in Calgary, and it's great to be here in this beautiful, beautiful building. It's much nicer than Edmonton's, I must say. It's beautiful. Dr. Verna Yu, our interim president and CEO, is here, and she'll talk shortly about a few developments, but particularly including the results of the provincial budget, which was tabled earlier, and what that means for AHS. But first, I'd like to update you on just a few matters. All the committees of the board have been working, including governance, quality and safety, and HR, but we're only going to hear from 3 other committees today. Most importantly, I think new for the board is the board has announced its formation of the Community Engagement Committee, which is a new standing committee that will oversee the organization's community engagement activities and approach. They held their inaugural meeting earlier in the month where they reviewed all our community engagement work, including the work of our health advisory councils, our provincial advisory councils, the wisdom councils, the foundations and the various trusts involved with the healthcare system. They also discussed membership recruitment, which will be going on. It's obviously early days for the committee. They're just getting established and set up, but I think it will be a great bit of work for AHS to be doing that will have a lot of benefit for patients and families and for all our communities and for the staff as well. Today, the board will also review approval of our 2016 and 19 internal audit and enterprise risk management department plan. A lot of words, but it's an important document for AHS. That plan helps the organization manage uncertainty by measuring, prioritizing, and responding to the risks that challenge our operations. Another vital document, the 2016-17 health plan, is almost complete. It will come to the board for approval at our next meeting in June. And finally, AHS continues the process of recruiting a president and CEO, and we hope that we will have a permanent president and CEO to announce at least before the summer. Today, I'd like to say a few words to the more than 100,000 AHS staff and clinicians who care for Albertans. The board recognizes the work you do, and we'd like you to know that you are valued and appreciated. Working in any large public organization has its ups and downs, and rightly so. This is an organization that is scrutinized by the public, the media, and elected officials. What I'd like to say today, though, is that based on my own experiences, meeting the people who work at AHS over the last few months, is that this group of dedicated, hardworking, and passionate people go the extra mile every day to provide the best care they can to Albertans. People at AHS work hard, they are compassionate, they're kind, they deal with complex, emotional, sometimes life and death decisions, and I'm proud to be part of this organization, and I think the whole board is. I'd like to thank all of those who are part of AHS. So whether you're a staff member, a clinician, a member of one of our advisory councils, a volunteer, or a partner, I just want to say today thank you on behalf of the board for all that you do. And now I'd like to ask Verna to give us a little update on what we've been doing recently and talk a little bit more about an exciting project underway at AHS.
Great. Thanks very much, Linda, and good afternoon to everyone. I'm very pleased to be here in Calgary for this month's public board meeting. And today I'd like to share with you some thoughts around the new provincial budget and what it means for Alberta Health Services. We all recognize that it's difficult economic times for everyone, and we in AHS really appreciate the fact that we've received a 3.4% increase in our base operating budget. And in the current climate, that's a really significant investment into our healthcare system and by extension into the health and wellness for Albertans. This base grant funding is a major component of our overall AHS budget and will enable us to maintain not only our core services, supports, and programs, but to invest new dollars into areas that matter the most to Albertans. Taking all into account into our revenue sources, this translates into a 2.6% overall increase. Details as to where we're going to invest these dollars and the outcomes that we expect are going to be outlined in the 16-17 business plan that's expected to go to the board for approval in June. However, I'd like to share some high-level items with you for this afternoon. With the increased revenue, we will be making further investments in some high-priority areas. We want to help our seniors stay safe, healthy, and independent in their homes. And when that's not possible, we want to make sure that they can access a continuing care living option tailored to their personal medical needs. To help us achieve these goals, we'll be investing dollars to expand home care hours, to open hundreds of additional continuing care beds across the province during this fiscal year. We'll also spend additional dollars to improve access to addiction mental health services, cancer care, and surgical care. Again, these are all areas that all Albertans have identified as priorities. Alberta continues to lose too many lives to dangerous illicit drugs, and there are new restricted grants from Alberta Health that's going to be invested to expand treatment for patients with opioid dependencies, including fentanyl, and to add additional detox beds where they are most needed. In addition, capital investments are going to be made in facilities, medical equipment, and information technology, as these investments are integral to our clinical and business processes, as well as key enablers to innovation and transformation. Our strategic clinical networks, or SENs, are also driving innovation, transformation, and value, and they will receive additional dollars to expand their important work. This is really an investment that pays dividends. SENs are developing care pathways that are improving quality of care while helping us avoid costs by reducing readmission rates and hospital lengths of stay. And AHS, we must always be cognizant of quality and, yes, costs. We must be good stewards of taxpayer dollars, and we must live within our means. Our revenues are increasing, but that increase does not keep pace with rising costs related to population growth, an aging population, increased use of services, inflation, and many other factors. So we need to bring down our rate of spending, and to do that, we need to find savings without affecting patient care. The good news is that that's possible, and we are, in fact, doing it. According to the Canadian Institute for Health Information, AHS spends 3.2% of its total expenditures on administration. That's among the lowest in Canada. We're also finding efficiencies in our business operations. For instance, we reduced our cost for consulting services by 35% since 2012, and a new mobility contract and policies have actually cut our costs by an additional 37%. Savings like this helps our financial sustainability and enables us to invest dollars where they will have maximum benefit. I'd like to talk about one project that we're going to be investing in that will improve quality of care, that will improve safety, and improve patient satisfaction for every Albertan who accesses the health system at any point of entry. We've allocated $32 million this past fiscal year to create the groundwork for one provincial clinical information system, or CIS. The CIS will consolidate the health information that currently exists in more than 1,300 different and unconnected systems used to collect and store patient information. The new CIS will create a foundational, comprehensive health record and plan for every Albertan. It will enable better flow of information across the continuum of care. It will support evidence-based care, ensure multidisciplinary team delivery and coordinated care, and improve transitions between care settings. This will benefit everyone who's in the health system, but especially those individuals who see multiple team care members with multiple conditions. With the CIS, these individuals will have their medical history, treatment plan, a list of their current and past medications, all in one central repository. Patients will no longer need to repeat this information every single time they meet a new care provider. Instead, the information is recorded electronically and not on slips on paper, which it still occurs in this day and age. And this information can be accessed by every health professional who's caring for the patient, whether it's a surgeon, a specialist, a family physician, or a pharmacist. I encourage you to watch the screen for a short video that shows in real-life terms what a CIS means to the health system and to the people that we serve.
The care that I've had was just super. I mean, if it wasn't for the health system, I wouldn't be alive today. I would like to see my history, my whole history online, your information, all your medications, what I had. I had 3 heart attacks, I had three bouts of pneumonia, COPD, I'm diabetic. I mean, I just can't keep track of it all, and they request it over and over all the time.
A CIS will mean that there's one place that the story is entered and then persists and travels with the patient everywhere they go in the system. So there can be no mistake about their medications, what worked, what didn't work. So our integration task actually means bringing together over 1,300 discrete systems into one. There's no advanced, high-performing organization in the world today that hasn't realized that you must integrate.
Like my dad has said, there is a lot of gaps with regards to patient information. Patients have to continually give their history and have to give their medications and things like this to clinicians. And that's information that clinicians need to make their decisions. Reality is, it is 2016. We are connected with smartphones and computers. We should be able to connect our health information to all of our providers. Our family doctors should know this stuff. Health information can save lives, and it will be better for Albertans.
So if you're trying to run a big operation like Alberta Health Services, you've got to pull it together. This is absolutely a pivotal part of our development as a provincial health organization.
The provincial CIS will be implemented in a phased approach, jointly funded by Alberta Health Services and Government of Alberta. The $32 million that we've allocated in our 2016-17 budget will cover costs for the initial steps for implementing the CIS across the province. The government has committed $100 million for the next 4 years to support this project, beginning in the 17-18 fiscal year. In addition to the $400 million committed by the government, AHS will be reallocating our resources and reinvesting the savings that the new system will generate. We've already started work on this project by consulting with a broad range of stakeholders, including our senior leadership, our staff, patients and families, communities, professional practice associations, and our SENs. And we're going to continue to engage stakeholders as this project moves forward in order to ensure that the system meets the needs of Albertans, not only now, but also into the future. We're going to be moving forward this spring with a request for proposals for the technology platform. And in the next year, we are going to complete the RFP process. We're going to be creating clinical standards that are going to be embedded into the system, as well as start building the basic infrastructure. This is a very exciting development, and as a frontline clinical provider myself, I can vouch that fact that the patients, families, and healthcare providers will welcome the new CIS. I would like to thank the staff, clinicians, and the patients who have been involved in pushing this project forward. And finally, I'd like to thank all of you today for attending today's public board meeting. AHS belongs to all of us because this is your health system. And I appreciate your interest in what we're doing to make the best healthcare system possible for Albertans. Thank you.
Thank you, Verda. Does anyone have any questions? I just have one question. I know this is down the road, but in the long term, I'm assuming patients would also have access to the records? That's the plan down the road?
Yeah, so there is plans right now, and in fact, Alberta Health is leading that initiative in terms of having a health portal available for all Albertans, and it's actually rolling out as we speak right now.
Thank you again. So the next item on our agenda is the Community Engagement Committee, and I wonder, Brenda, if you could update us on the committee.
Thank you, Madam Chair. I'm pleased to provide an update from the Community Engagement Committee. Alberta Health Services recognizes the importance of engaging with stakeholders from patients to the general public and has established mechanisms for that. Provides a unique and meaningful opportunity for the stakeholders to provide valuable insight and perspectives to the organization. The board has also recognized the importance of community engagement and the important work that the advisory councils are conducting across the province. And as a result, the Governance Committee recommended the establishment of a Community Engagement Committee as a standing committee of the board. And so we actually had the inaugural meeting of the Community Engagement Committee on April the 13th. As a background for its work, the committee was presented with an overview of community engagement throughout the organization, including the work of the Health Advisory Councils, the Provincial Advisory Councils, the Wisdom Council, the foundations, including the trusts, the Health Professions Council, and the Patient and Family Advisory Council, and the Alberta Clinician Council. Mr. Larry Albrecht, Chair of the Council of Chairs of the Health Advisory Council for the Prairie Mountain Health Advisory Council, attended the meeting and spoke of the composition of the meetings and the councils of chairs. He spoke of the roles of the Health Advisory Council. He noted that throughout the province, and that because of geographic and demographic differences, that they do function a bit differently, but he advised that they all have annual work plans and also participate in initiatives presented by AHS. He noted that there are over 170 volunteers in the health advisory councils and provincial advisory councils. He also noted that they meet 4 times a year with public meetings attended by some leadership, and that there's time on the agenda for the public to ask questions as well. The committee at this meeting also discussed membership recruitment on the various committees which are underway at this point across the province, and the committee was advised that a community engagement framework is being developed by management at AHS. The committee reviewed its terms of reference, and these will be further reviewed at its next meeting in May. And this summarizes the business conducted at our April meeting.
Great, thank you. Does anyone have any questions for Brenda or Colleen? No? All right, thank you. Now, Finance Committee, if Richard, you could give the report in David's absence.
On behalf of the Finance Committee, I'd like to offer a report. David, unfortunately, is not able to join us today. So the Finance Committee has had a meeting on April 14th. 2 documents have been reviewed. One is the health plan and the other one is the business plan. The President referred to the provincial budget, which was introduced on April 14th, same day as the Finance Committee meeting, and it provided an envelope that she described as being an increase over the previous years. The Finance Committee has reviewed, as I said, both the health plan, which lays out the strategies that will be pursued, as well as the business plan or the budget, which describes in some greater detail where the money will be spent. These documents will be reviewed by the board at the board meeting in June and then submitted to the minister for final concurrence. After those approvals have been achieved, the AHS will post on its website both documents. That is the end of my report.
Any questions for Richard? No? All right. Great.
Thank you, Madam Chair. The Audit and Risk Committee met on the 14th of April, and it's standard practice that the Office of the Auditor General and our auditors, KPMG, are guests at the meeting because they're both external auditors of AHS. Both the Auditor General and KPMG spoke of work underway for the audit on the 2015-2016 fiscal year. The Chief Audit Executive reports annually to the committee on the adequacy and the relevance of the internal audit's mandate, authority, and responsibility as defined in their internal audit charter. The committee is responsible to recommend annually that the board approve the internal audit charter. The committee did review the internal audit charter dated April of 2016, and at that time the committee recommended that the board approve this document. Therefore, I move that Alberta Health Services Board approve the amended internal audit charter, April of 2016, in the form reviewed by the committee, with such non-substantive changes that management of Alberta Health Services consider necessary advisable.
Thank you. Is there a seconder for that? Marlis? Any discussion about that? No? All in favor? Okay, that's carried. Thanks, Hugh.
Thank you. The committee is also responsible for reviewing the internal audit and enterprise risk management plan and recommending its approval to the board. The plan is a 3-year rolling plan that is aligned with the AHS strategic priorities, key risk, and the health plan. The plan addresses mandates, value drivers, departmental goals, strategies, and projects. And after reviewing the plan, the committee recommended that the AHS board approve the plan. Therefore, I move that the Alberta Health Services Board approve the 2016 to 19 Internal Audit and Enterprise Risk Management Department plan in the form reviewed by the board, with such non-substantive changes that management of Alberta Health Services considers necessary or advisable.
Thank you. Seconder? Richard? Any questions for anybody? All right. All in favor? That's carried.
As a final matter, the committee reviewed its draft terms of reference document. There was significant feedback at the committee level, so the document is being reworked, and we will review it further at our next meeting.
Thank you very much. Any other matters anyone wishes to raise? With that, I would say this very short meeting comes to an end, and could I get a motion to adjourn? Marlis, Hugh, all in favor? We're adjourned. Thank you very much.